Hi, welcome you to my channel. Let's talk about IBS, which stands for Irritable Bowel Syndrome. What it is, the symptoms, the diagnosis, the types, and most importantly, the triggers of IBS. Then in my next video, I'm going to show you how to treat and manage this condition the natural way if you suffer from one. I'm also going to give you IBS diet, what not to eat, what to eat, and some very effective supplements to deal with irritable bowel syndrome. So if you're a person or you know someone who suffers from IBS, this is it. You are at the right place. And if you are new to my channel, kindly subscribe and tap that like icon you see right there on your screen, because you will definitely get value out of this video. The more likes we get, the more this video reaches many people. So kindly give us a like by tapping that like icon you see on screen right now. And don't forget to also share this video with all your loved ones, especially those who suffer from IBS. What then is IBS in the first place? That is Irritable Bowel Syndrome. It is a very common condition and it affects 1 in 10 people, and it is more common in women than in men. And all patients that I have personally seen with an issue of IBS are women. And interestingly, many don't really take notice of this condition. And IBS is simply a combination of GIT symptoms or a pattern of symptoms which include abdominal pains with some sort of changes in the bowels like diarrhea or constipation, or a combination of both. You could also suffer from nausea, vomiting, bloating, burning sensation, mucus stool, and others, and they occur for a very long time. And these symptoms can differ from one patient to the other. One thing you should take notice is that the abdominal pain is a cardinal symptom of IBS, and so if you are not experiencing any abdominal pain or cramps but experiences the other symptoms that I just listed, then it is likely not an IBS but some other GIT condition. And irritable bowel syndrome or IBS is a very terrible condition. It is a disease you will never wish for anyone, and it affects you physically, and most importantly, it has negative impacts on your mental health or psychologically. So having said that, let's look at what causes irritable bowel syndrome or IBS. The exact cause is not known, but it is a functional disorder causing the nerves and the muscles of the large intestine, predominantly the colon, leading to a combination of allergies, oversensitivity, and intolerance to foods, leading to all the symptoms that I just listed. And because the exact cause of this functional disorder is not known, no specific formulation has been made for treatment, but scientists are still working on it. But one key center focus is your gut microbiome. And whether you suffer from IBS or not, the integrity of your gut is paramount to your health and should be treated well by all, especially those with IBS. Having defined for you what IBS is and the symptoms of IBS, let's look at how we can diagnose somebody who has an IBS. There is the risk of misdiagnosing with this condition because there is a number of GIT conditions or other conditions that can also mimic the symptoms of IBS. And unfortunately, there is no definite test to diagnose someone of IBS. There is no blood test or a specific blood test or even stool test to isolate somebody who may be suffering from IBS. And so the clinician has to be on top of his game when it comes to history taking. Ultimately, in order to diagnose somebody of IBS, you have to fulfill specific pattern-based criteria called the Rome-IV criteria. And in order to qualify for this criterion, number one, the person must have a recurring abdominal pain at least once per week in the last 3 months. Number two, at least 2 specific changes that relate to your bowel movements. Number 3, changes in your stool frequency. And lastly, changes in your stool. If a person fulfills these 4 criteria, then that person is suffering from IBS. And if the history of the client or the patient do not fulfill these 4 elements, it is most likely not an IBS. And if you misdiagnose it, it can affect your treatment and your management plan. And such conditions that can mimic the symptoms or have the same symptoms of IBS include IBD, which stands for inflammatory bowel disease, like the Crohn's disease, the ulcerative colitis, the bowel chronic infection, celiac disease, lactose intolerance, small intestinal bacterial overgrowth, that is the SIBO, simple chronic constipation, infective diarrhea, cancer, and even patients who are above the age of 50 years old. Are there types of IBS? The answer is yes. There are basically 4 types of irritable bowel syndrome, and number 1 is IBS-D. The D stands for diarrhea. Number 2 is IBS-C. The C stands for constipation. Number 3 is IBS-S mixed, which means that it's either the person is suffering from constipation or diarrhea, or a mixture of both. And then we have IBS-U, which is called the unclassified. In other words, we cannot classify your bowel movement, whether it is constipation or diarrhea. Now, having said all these things, it is important to look at the triggers of IBS, and that is the main focus of this video. What are the triggers of IBS? And the triggers refers to foods when you eat that irritate your gut and you start to experience the symptoms of IBS. So once we can identify these triggers, we can avoid them or lessen them in some cases, so we can help with management or treatment. Therefore, there are 3 important questions to ask your client or to ask yourself if you suffer from IBS or you start experiencing the symptoms of IBS. Number 1 is, what did you eat? Number 2 is, when did you eat what you ate? And number 3 is, how long have you been experiencing the symptoms? These are the 3 most important questions you need to ask yourself once you begin to experience the symptoms of IBS. So as someone who suffers from IBS, always keep a food log. A food log will help us narrow down what you ate and what is irritating your gut. And that is the first step to dealing with IBS or irritable bowel syndrome. So let's look at these triggers of IBS. And the first one is FODMAPs. FODMAPs stand for fermentable carbohydrates, oligosaccharides, disaccharides. These are the sugars, monosaccharides, and polyols. And FODMAPs increase gas production, which stretches and expands the colon. And IBD or IBS are very sensitive to these stretches. And I'm going to talk more on FODMAPs in my next video. The second trigger is stress. Stress has been found to trigger IBS, and patients with IBS through research have found to have increased levels of anxiety, depression, phobias, and so stress is both a risk factor and also a symptom. And the elimination or reduction of stress has been found to significantly improve on your IBS. The third triggers or the category of triggers is caffeine, alcohol, spicy and fatty foods. Then we have the dairy product, dairy milk or dairy product. Now, egg is not a dairy. When we talk about dairy, we are referring to milk and its product, such as the cheese, the yogurts, the kefir, the butter, the milk, because the protein in a dairy is called casein, and casein is the irritant in this dairy that triggers the symptoms of IBS. Then recent research also found out that children who were repeatedly given or treated with antibiotics during their childhood might increase the risk of IBS by altering the normal gut bacteria, which in turn influences nerve cell development and mood, therefore increasing the risk of IBS. So a parent who has been giving their ward or their children a lot of antibiotics at that early stage, please stop. If you are doing that, you are increasing their risk of developing IBS as they get older. Then we have the hydroxylates, like the raw salads or the raw foods. Then the others also include cold foods like the ice water and the ice cream. Now, anything cold is hard on your digestive system, so avoid cold stuff. You see, with IBS, the triggers, the management, and the treatments are usually individualized. So you have to identify your trigger and do the needful. So this is the end of our discussion on IBS. In my next video, I'm going to talk to you about the best IBS diet and some very effective steps and also effective supplements to treat and manage your IBS the natural way. And I'm sure you got value out of this video. So why don't you give us a like by tapping that like icon you see right on your screen. And also don't forget to bring in your questions and your contribution in the comment section of this video. Don't send me a personal message. Put it in the comment section of this video so that others can also benefit when I answer, or any contribution you may have. Share them in the comment section of this video. Hey, Jesus Christ is the same yesterday, today, and forever. God bless you.